Hi, everyone, and welcome to the 30th episode of Vitals and Voices. I'm Ladika, and I'm the founder and host.
And I'm Camden, and I'm the co-host, and together we serve on the executive team of Vitals and Voices.
Vitals and Voices bring together different stories in healthcare in order to build a supportive community for the future generation of medicine.
Now, please welcome our guest, Brian.
Hi, thank you so much for having me on here. I'm excited to be a part of the podcast.
Of course, thank you. Thank you so much for being a part of this episode. Again, it means so much to us that you'll be one of our guests today on Battles and Voices. Brian, feel free to introduce yourself and share some things about who you are.
Great, thank you. So, my name is Dr. Brian Kendall. I'm a board certified emergency medicine physician. I've been practicing for over 10 years now. I am married to my wife, Brittany Bankhead, and she is a double board certified. I always have to put that in there because she's one up to me. Double board certified trauma and critical care surgeon. Together, we have two kids. Our son, who we call our medical school baby, he's 13 years old. And then we have our 7-year-old daughter who we had while Brittany was still in residency. And then Brittany and I were married before we even went to medical school. We actually applied to medical school on our honeymoon. We went through medical school together. We went through the couples match, which didn't work for us. We've been through it all. I started off my residency in New York City at New York Medical College at Metropolitan Hospital, and then transferred to where Brittany was doing her residency down in Dallas, my intern year. I went to UT Southwestern and at Parkland there in Dallas, Texas, and did the rest of my residency there. Since that time, I've kind of followed Brittany around as she has done all of her training. So I've worked in a bunch of different places, the Detroit area, the Boston area, San Antonio, Texas, Austin, Texas, Dallas, Texas, Lubbock, Texas. And we currently live in Charleston, South Carolina, where I am I'm one of the core faculty and in charge of medical students who aren't planning on going into emergency medicine. I'm doing their clerkships here. In addition to that, being a physician and a dad and a husband, I'm also an entrepreneur and a writer and a podcaster. My mission is to help people avoid seeing me in the emergency department. So all of my content is based off of this on Instagram, TikTok, Substack, and our podcast that we have. We talk a lot about helping people do all the things that they need to do in order to help avoid the emergency department. Our podcast is called Coffee Walk MD, and Brittany and I co-host it where we talk about having how to cure boring conversation with whatever relationship that might be in your spouse or your partner, with your family or friends. And we take people along on like our coffee walks and we talk about all sorts of topics from everything from just daily life to parenting all the way up to like global politics. And so it's a lot of fun. And then we also have a business that is called BBKT Properties that we do like long-term and short-term rentals. And then Brittany also has a business that I'm involved in called Modern Mom Lab that helps busy moms help other busy moms by either becoming a family virtual assistant and helping those busy moms out, accomplishing everyday tasks. And their motto is that they want to help moms have it all. So lots of stuff going on, and it's been a very fun journey to this point.
It sure sounds like there's been a lot and a lot of traveling as well, but I can tell that you really love to do all that, and especially
Yes.
being by your wife's side and all of it is beautiful.
Yes, it's been great.
So, can you tell us a little bit about what inspired you to specifically go into healthcare and emergency medicine as well?
Yeah, for sure. So, it's that cliche response of like, ever since I was a little kid, I wanted to be a doctor, but I have the proof. There's a picture of me I got for like my Christmas when I was 3 years old. I got a doctor kit. There's a picture of me listening with a stethoscope to my granny. And so I have the proof that ever since I can remember, I've wanted to be a doctor. And I think my true inspiration was my grandfather. He was an OBGYN physician. And I just really looked up to him, and it was so cool. Wherever we went, he got recognized by the patients that he had taken such great care of, and they all had just wonderful things to say about him. And you could tell he was such a big part of his community, and that really inspired me. For emergency medicine, I honestly didn't even know emergency medicine existed until in between second and third year of medical school. I didn't even know that was an option. I thought I wanted to be a surgeon. But then I shadowed a resident at the Baylor College of Medicine in Houston at their hospital, Ben Taub, and it was a life-changing experience. They had this huge, like kind of open bay with just curtains of beds for beds. And we went from one patient who had like a severe case of rhabdo from doing 1,000 push-ups in jail, all the way up to somebody who had like active tuberculosis, and it was just crazy. It was a wild shadowing experience, and it just really like excited me about, hey, the emergency medicine could be a something that I really want to do, and so that's what inspired me.
Definitely. I really love that story and how you had that passion ever since you were a child. So you shared that your grandfather was an OBGYN and
Mhm.
he played a major role in inspiring your career. How has his influence shaped the way that you practice emergency medicine?
Yeah, so I think about him every single shift. I try to have compassion, but I also try to be direct. He was very much tell you how it is kind of a person, and I feel like sometimes in medicine that gets lost nowadays. That sometimes we want to tell people what they want to hear instead of what they need to hear, and so I try to be very direct with my patients, letting them know, what we do and don't do in the emergency department. Will also, being empathetic to, you know, I, when you come to the emergency department, typically it's one of the worst days of your life. And so trying to help people through that in the best way that I can is, another major goal for me.
That's beautiful. And what aspects of emergency medicine keep you the most energized and happiest when you're on shift?
Yeah. So the thing that keeps me the most energized is that constant mystery of what is going to come through the door next, right? Like there's never the same shift. Every single shift is completely unique, and at any moment something could come through that door that you have to just be on your toes and have everything, all the knowledge in your brain and all your resources ready to go, which to me is really exciting and fun and keeps it very engaging. And then the ability to take that person who's having probably the worst day of their life and hopefully turn it completely around and make it to a point where maybe I can discharge them home or at least get them feeling better and get them admitted to the hospital. So that is really what keeps me going on shift. And then outside of shift, it's education. So I really love all the work that I do, trying to not only educate medical students and residents where I work, but then also the stuff that I do for everybody through the social media platforms that I'm on, just trying to help people understand what it is we do in the emergency department and how you can avoid the emergency department and help people avoid the frustration and the high bills and all the time that it takes to go to the ER sometimes.
I definitely agree. So your social media work focuses on helping people avoid unnecessary ER visits. So what do you think, are some common misconceptions about the ER that you wish every patient, kind of understood?
Yeah, so I think one of the biggest misconceptions, and therefore one of the things that causes the most frustration for patients coming to the ER, is that we provide answers. That, somebody comes in, they have whatever their chief complaint might be, and that we're going to tell them exactly what's going on. But the emergency department is not for answers, it's for making sure that there's no emergency going on. And so that's the tools that we have in the emergency department are based off of that, right? Like a CT scan of your abdomen, a CAT scan of your abdomen isn't going to show everything. It's not going to show masses in your colon. It's not going to show gastritis. It's not going to show, gallbladder issues all the time. It's really there to find those emergencies, the appendicitis, the bowel obstruction, the vascular problems like the aortic dissections or the abdominal aortic aneurysms, that kind of stuff. And so that's that's where I see people get the most frustrated is we run all of these tests for these chief complaints that people come in for, and then they are frustrated when we come in and we say, hey, all the tests that we ran look great. You know, your CT scan was normal, your blood work came back looking good, your urinalysis looked good, your vital signs look good. You know, and so they're like, well, why is it not showing anything? Like I'm in pain, I need to have an answer. And it's like, yes, you know, there are answers out there, but for as far as the emergency medicine goes, emergency department goes, we have done everything we can to make sure there's no emergency. Now the rest of that workup is done by your primary care doctor or a specialist or whoever it might be.
I'm glad that you're like trying to help people like avoid it. I think that's some great work. And I know there's a lot at the beginning. So you also mentioned that you were involved in several business virtues.
Yes.
Um, how do you balance this entrepreneurial side of your life now, like, sorry, with of your life with a demanding clinical career as well?
Yeah, for sure. Well, you know, that's a great question. For emergency medicine, I think that's one of the best things about the emergency medicine career is that you know, although you end up working weekends and holidays some, you know, for a full-time ER physician, most people work maybe 13 to 15 shifts a month, and some people work even less than that. And so that really frees you up to pursue other passions and other goals, which again kind of help me stay refreshed. You know, when I'm able to engage my mind in other things other than just medicine, it really helps me keep a good perspective, helps me stay refreshed when I go back on shift and not feel like I'm in some monotonous cycle. So it works out really well, and it really comes down to, I mean, Brittany has been integral in this. She's so good at keeping us organized and keeping, you know, our calendar straight and making sure that we have all this, you know, this laid out specific times to do all of these things. We try our best to do them while the kids are at school. With her being a trauma surgeon, she also works shift work. So a lot of times we'll have days during the week that we're off while the kids are at school. So we try to get a lot of stuff done while they're in school. So that way, when they're out of school, we are able to spend time with them. So yeah, my career choice has really allowed me to have the time to pursue those other passions.
I really love that. So you mentioned earlier in the beginning that you've mentored dozens of medical students and residents. What do you see as the biggest gaps in medical training today, and how do you try to address them through your mentorship?
So medical training and gaps, what I see in, at least as far as medical schools go, I've worked with a ton of different medical students from a lot of different medical schools. I think that what I'm seeing right now is that there's a lack of hands-on training. It used to be we would get medical students who would come in knowing how to do a simple like laceration repair. As a medical student, I personally, like in medical school, had done like 10 central lines and 5 arterial lines, and I had over 20 intubations and all sorts of stuff as a medical student before going into emergency medicine. And now we get residents who start off residency and some of them don't even remember how to suture because it's been so long since they've been able to do a suture. So I think it's those hands-on procedures that I'm noticing haven't been, especially since COVID happened, that haven't been able to be as integrated into medical education as they once were. And I hope that you know, at some point we're able to get that remedied because it's a big part of, I think, going through medical school, learning how to do those type of situation, you know, procedures and stuff, even if you're not going to be using it in your residency or in your career.
As somebody who loves hands-on learning and who also wants to go into the medical field in the future, I really would love to do like more hands-on activities.
Hmm.
So I hope to. I hope
Yes, I
to.
hope so. Yeah, I hope so too. I mean, you know, as a medical student, you really you can have some control over that, right? Like over where you decide to do your electives, where you go to medical school as well. I mean, that you can, when you go into your interview process of different medical schools, and when you're looking as a third and a fourth year medical student to go do your rotations and elective rotations, it's a really important question to ask of, hey, what kind of procedural skills am I going to get in this medical school or in this rotation? Am I going to be able to get that hands-on experience that I want? Or if you don't want that experience, is this one where I get to avoid it? I don't want to touch a scalpel. I don't want to touch, a suture. I don't want any part of that. Can I avoid it here too? So it's a good question to ask as you look around at different medical schools and rotations within that medical school.
Perfect. I also know we mentioned this earlier that you've held leadership roles and trauma operations clerkships and I might pronounce this wrong, but ATLS
Yeah.
Atlas training.
Uh, ATLS, yeah, the
ATLS.
trauma, like kind of like ACLS, but for trauma. So like
Okay.
ATLS. Yep.
So, which leadership challenges have taught you the most, and how did it change the way that you lead currently?
Yeah. So all of them have taught me so much. My assistant medical director role with the emergency medicine department within a level one trauma center definitely taught me a lot, though, about people skills. There was a lot that I accomplished in my time there as the assistant medical director. One of my biggest things that I was most proud of was our integration of our emergency medicine residents running traumas. So in so many different hospitals, the trauma program is very insular and doesn't really allow a lot of outside um, collaboration. Their surgical residents get to run most of it. For emergency medicine, most of us just get to run the neck up. So you only are getting to like intubate and maybe do a central line or something like that. However, when emergency medicine residents graduate, they go work in a lot of different ERs that don't even have a trauma program. There is no such thing as a trauma surgeon who's there 24/7. And so it's really important for emergency medicine residents to get comfortable running traumas and doing it in a way where they can stabilize these patients and then get them to a trauma center. And so one of our projects that we worked on was getting our residents the ability to run traumas by themselves with the trauma surgeon either in the room or they're on the periphery to step in at a moment's notice if need be. But they were able to run those level two and level one traumas, and it was such a great experience, and it taught me so much about collaboration, about making and bringing all the stakeholders in, all the stakeholders in to a conversation. So you're not just talking between emergency medicine and trauma, you're also talking about emergency medicine, trauma, administration, orthopedics, vascular surgery, all the nursing staff, and everybody else that could potentially be involved in this, bringing everybody together at the same table and hashing out all of those details so that it ended up being a successful program. There were several bumps along the way where one service wasn't happy about something that was going on, and so then we had to come back and rehash it. But it was an amazing collaborative effort that got it there, and that's what I took the most from that. Is leadership isn't just me as a one person making a decision. Leadership is bringing all the pieces together and having everybody communicate in an effective way so that whatever you are rolling out as the leader is successful. Otherwise, it's going to fail.
I really love how you coded it at the end, how you said that it's just not one person being themselves as a leader, but having the group or the coworkers come together and
Hmm.
feel included. I
Yeah.
love that. So you mentioned being really proud of your clerkship director work.
Hmm.
What impact or story from that role stands out as a moment that validated your efforts?
Yeah, I love working with medical students. I went through a crazy path through medical school. We went to Ross University, which is an international med school, and we tried the couples match and it didn't work. And I actually didn't match the first time around and got a spot outside the match. I mean, it was all crazy. So I went through it and it was so difficult. And just kind of like what I do now with trying to help avoid people help avoid the ER, I do my best to help medical students never have as difficult time as I did going through that process. And so one of the things that I love the most was sitting down with medical students and just boiling down that process to only what they needed to know to be successful for what their goals were, and helping open their minds and expanding their ideas of what they were capable of achieving. There were some people who would come into my office and say like, "Oh, I really wish that I could go to this program or to that program, but I don't feel like I have this or I have that." And I would look at their application and be like, "No, like you definitely have what it is, but if you will frame it this way and you'll write this way and you'll rotate here, that's going to give you the best chance to get into that what you would consider to be a reach program, and to then have students match into what they were thinking was their reach program and just be ecstatic, was this the biggest reward for me to see that happiness on their faces when they realized that dream. So that was always my goal, and it was so rewarding to see that come to fruition time and again.
That is so beautiful, and being able to make like a full circle moment with that too.
Hmm.
So, with your background in clinical work, education, research, entrepreneurship, and media, what direction do you see your career evolving towards maybe over the next generation, next decade?
Yeah, the next decade. Great, great question again. My hope is that I continue to grow in my different roles that I have in my current program here. We are done moving. We are so we are like we want to stay in one place, and so I'm really happy to be here and really get some roots set in Charleston. I want to continue. I've found that my passion is education. And so I know that no matter what I do over the next 10 years, it's going to involve some sort of teaching. I plan on continuing to work clinically as an emergency medicine physician. I hope that as time goes on, that I'm able to reduce those hours a little bit and then bring up the hours on some of the other stuff that we are working on. So that's my goal.
I really love that. And to wrap things up, do you have any advice to anyone that's listening right now, hoping to enter the same line of work that you're in?
Yeah. Uh, lots lots of advice. To me, one of the biggest stressors that I remember from medical school and even now is the people out there. The people love to talk, right? They like to talk about all the things that they are doing and all the things that they are accomplishing and all the work that they're putting into this, that, or the other. And in medical school, that came through as people are studying for the next test or they're getting ready to apply for residency. People would sit there and talk constantly about, oh, well, I'm using this material to study, and then I'm also doing this, and then I'm also doing this. And you go into these tests feeling like, oh my goodness, like I feel like now I'm underprepared or that I'm not ready to take on this test or go apply for residency. And it's really important in those moments that you look within and reassure yourself that it's okay. Like everybody has their own path. And what's most important is that you are consistent. If if you're going to do Anki, do that. If you're going to go to every single lecture and take notes and make your own flashcards and your own stuff, do that. But if you sit there and you try to do what you want to do plus what everybody else is doing, you're never going to be successful. So figure out what works for you, stick with that, reassure yourself that, hey, I'm doing my best. And then if the results after one test or one thing, don't come out the way that you wanted to, then reassess and see, okay, what do I need to change? What do I need to uh, do differently in my studying and stuff like that to make it to where I'm reaching my goals and reaching my dreams. But don't let other people put up a bunch of noise and distract you from what you're supposed to be doing.
Well, that is beautiful advice, and thank you so much for sharing your accomplishments and all the hardships you've overcome.
You're very
Yeah,
welcome. Thank you so much for having me on the podcast.
of course. Thank you for coming on. It was so incredibly inspiring to hear about your strength and the impact that you've created already.
Thank you. Thank you. And best of luck to y'all. And, it's going to be a fantastic career. You've made a great choice going into medicine.
Thank you. And to everyone tuning in, thank you so much for joining us today on on this episode of Vitals and Voicements. Your engagement and loyalty means the world to us.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes on Battles and Voices.
We'll see you next time.